Okay, so our topic for today is to discuss, I would say, a phenomenon that everyone will probably have some experience in, which is fatigue. And our goal would be specifically to focus on strategies that people might use to manage Parkinson. And we can share that we try to find lots of solutions for you, but we're actually quite disappointed with the lack of solutions. And this just means that we have to try to dive deeper into how people are already living with this and dealing with it. So we did want to share through the questionnaires that we sent to you, is like, how are people dealing with it specifically in your community, since the world is very big and people could use different strategies. So first of all, let us just get an idea about what commonly we think about when we think about fatigue.
Yeah, I mean, the clinical definition is going to be an abnormal and excessive lack of energy. And so increased effort when you attempt to do daily activities, and it's different and distinct from the sleepiness and the lack of motivation and depression that are often common in Parkinson's. So fatigue is its own entity, even though it can co-occur with these other issues. Yeah, you got that? Okay. So there is fatigue that is normal, that you would expect to happen, and generally it's a normal reaction to exertion. It doesn't happen all the time, so we say it's transient. It appears and it disappears, and often it disappears in response to resting. And more importantly, it doesn't have an influence on your daily activities. That's really important. Okay, when you talk about clinically significant, clinically significant fatigue, that's something that's going to be present all the time. It's chronic. It's happening even when you're resting. It might not be responsive to the resting, and it can happen at times that you don't expect. It can happen suddenly, kind of the way off periods can happen suddenly. And then you'll find that maybe mild or moderate exertion, like an exercise class or doing something outdoors, can turn into an issue where you worsen the fatigue for hours and hours and maybe days. So it's really out of proportion to the activities.
Focus on what?
From a clinical perspective.
Oh, thank you.
Hold on a second. And mute all here.
So what we consider severe would be something that really impacts your daily activities and your socializing. So if you want to have two criteria in mind, it's if it's really affecting my daily activities and me being able to socialize with other people, which summarizes into impacting your quality of life. But this is how I would say health professionals would take some note on it.
I'm just checking. Everyone's able to see our slides okay? We nobody have any issues? We had the picture of the two people here? Very good.
Yeah, I see it over there.
Yeah, I thought so too. Yeah, making sure.
Okay, so when we asked, we sent out the questionnaires for everyone to answer, and we had 25 responses. So as I said, that's usually very good for questionnaires, and it's good to know exactly who we're talking to about this problem. And what was fascinating, of all the questionnaires that we sent out, this one really highlighted how almost 100% of the people that answered are dealing with fatigue.
Yeah.
So now if we think about, and they're dealing with fatigue, and what was surprising is the majority of the people were actually dealing with fatigue for more than a year. So this is can be really perpetuated in time. And we actually had someone that said 15 years, so that means it's probably a primary symptom of the disease itself, right? So we want to just talk about these different ways that it might affect you. And when we think about, so we asked you, okay, so how would this look like in terms of activities? And there is a whole list that we created, and let us see which one was highlighted most. So we are just letting people in. So if you give us just a second, people that are coming in, will. I need to see this.
Okay, very good. Here you go.
Okay, fine. So we see that our number one is actually not surprising, which will be difficulty engaging in physical exercise. And now we live in a time where everyone probably around you is always saying that physical activity is probably the solution for almost all the symptoms, if not all, of Parkinson's disease. Which now, if I'm dealing with something as extreme as feeling always tired, how am I supposed to be able to engage in exercise? And we will discuss a little bit on that. And then we see that if we have our second portion.
Okay. I'm just looking here. Someone says that they can only see portions of our slides. I wonder if it might be your view on the screen. You might need to maximize that. Everyone else is seeing. If anyone's not seeing our entire...
Could you please unmute and just tell us if
Yeah.
everything's okay with the slides? So is it only one person?
We have a secondary computer.
Okay.
Everything okay?
Great, yeah.
Okay.
Because I can see it on the other computer. It looks like it's going. Thank you.
Then we had, okay, so let's focus on the second one, was difficulty concentrating and thinking clearly. So here we're having fatigue affecting how we think, right? So, and we can come to a concept of mental fatigue. We had then others affecting which I get more tired quickly than other people I know. So you're out with friends and you clearly see that there's a difference between how fatigued you get on the same activities. How about it takes me longer to get things done as well? So here is, I'm probably taking more and more time in the morning to get ready, and I feel exhausted after I do an activity like that. And then you have other things like I feel tired even when I haven't done anything, and I can imagine how scary that might feel, because it's like, does this mean that I have some other issue? What is going on? I haven't even started working and I already feel so tired. And then another one that was highlighted, also 12 people responding, if I wasn't so tired, I could do more things. And I think this is where we see how the fatigue might be stealing away activities and I would say life, right? As you can see, the list goes on, but we wanted to really think about what was the biggest challenge that people were dealing with when we're referring to fatigue. We created different categories, and one was in terms of cognitive and emotional impact, the biggest challenges was. So let us share some of these comments that people refer to us. So at this point, the fatigue is probably largely cognitive related, but the challenge is difficulty planning things ahead of time. So that makes it more challenging for us to organize our day. Then we had other comments like avoiding a feeling of hopelessness. So we can easily see that if I'm tired, I'm unable to engage in any activity, and that leaves me hopeless. Feeling overwhelmed by life or difficulty motivating him would be probably a care partner referring how difficult it is to interfere. If the person is fatigued, how do I motivate the person to have any type of initiative throughout the day? When we think about outdoor activities, the comments was the biggest challenges was getting my wife out of the house and to be active. If I am outside visiting a place, I need to find a place to sit. So here we already have a glimpse of the needs or ways people are dealing with it. And I have to miss or leave earlier from any kind of social gathering. So I think by looking and diving into these comments, we can already find ways and strategies that people are dealing with it. And we wish that the evidence and the scientific community could bring much more, but let's dive into this. So leaving places earlier, finding places to sit. When we think about challenges that people refer to indoor activities, we had a person saying climbing up the stairs to get to bed was quite challenging. We can imagine that if we have already at the end of the day, naturally people will feel more tired. It's more common. And the medication is also different at the end of the day. So by the time you go to bed, you might already have a mixture there of physical fatigue with all the medication. So it's worth us brainstorming about when does this happen. So this was an interesting comment. Then we have others like cannot accomplish tasks that need to be done. Physically doing anything will put this person in fatigue. Falling asleep during the day, so there's an impact on the day, and we will get into how we distinguish this type of sleepiness, how sleep and fatigue are linked. So not being able to complete items on my to-do list, so we might be putting too much on our list according to the energy levels that we might have, and then getting things done. And here comes the exercise component that we saw that was one of the things that was impacting more. So this, I wouldn't say, because people tend to, you're just using that as an excuse, or tend to easily say that the person is trying to not exercise because I didn't want to use the word lazy, because that is very critical. But it's very difficult to understand that if you are completely exhausted and tired, No one feels like exercising if you feel like that, right? And it's perfectly understandable. And how do we bypass this? Now there is where we have to really be creative. So making myself do more and sedentary lifestyle and less able to exercise was also referred to as one of the major challenges. And I think the final one was also regarding sleep. So people felt that, for example, at this point, it is generally manageable with afternoon naps since we are retired and have flexible schedules. It is, however, a challenge to try to get her to have enough continuous sleep overnight. So when we have an underlying sleep difficulty, we will immediately also see that during the day it will be affected, the alertness will be affected. So another comment was, as a caregiver, I have difficulty getting him to nap. So eventually the family might perceive that the person is so tired that ideally the solution should be napping. There might be other options that we want to consider, but obviously not knowing the rest, we can't comment more. Falling asleep during the day, again, is this a sleep problem? Is this a fatigue problem? Is this a depression problem? So this already starts bringing us to reflect on what could be underlying this problem. And then finally, we had waking for medication and food. And we actually had a comment in one of the questions is like, should I wake the person up if I have medication? Now, it depends on how much the sleep and how much time we let the person sleep. That's how I would answer. Because the medication being taken on time is the way for us to keep, I would say, the symptoms under control. And so if it's in an interval of half an hour, usually people don't, it's not problematic. When I say the professionals probably won't be telling you that will have a negative effect, so half an hour after. But I think if you totally skip medication intake, you can probably expect that you might have difficulties after.
You're going to introduce a lot of chaos if you do that. Yeah. One thing too is, when you're taking a nap, you're talking about a 20 or 30 minute nap, so hopefully they're not going to be 2 or 3 hours.
Again, it's worth discussing and seeing. I can imagine that the perception was probably the person sleeping like an angel, and I'm going to be a cruel person by waking the person up. Maybe that was the perception behind it.
Could be, yeah.
Okay, so
in the cases of angelic sleeping, let it rest for 20, 30 minutes. Yeah, okay, very good.
Eventually, and then I would add in how we wake the person up.
Yeah.
Maybe by not using words, but a slight touch is usually less aggressive, I would say. Aggressive is, for the person that's in deep sleep and then being woken up suddenly can be perceived as aggressive.
Yeah, disruptive for sure.
Yeah. Okay, so we tried to think about, can we give practical orientation and guidance on how you should be looking at this problem, and this is what we came up with. And the idea, I think, is really to highlight, first of all, to really get a clear diagnosis of fatigue, which might be a challenge because, as you see, it's very subjective, the terminology. We still have lots to research regarding this topic. So we're very limited in this part. But by getting a clear diagnosis, we can have a distinguish between if the person is having other issues. So it's important to know what was interesting. I was going to share that. What was interesting is that almost everyone said that they had a fatigue problem, but only 30% have discussed this with the health professional.
Yeah.
Now, what I would highlight is that the health professionals at this moment have enough knowledge of Parkinson to know that this is a symptom. Maybe many years ago, people wouldn't talk about non-motor issues, depressions, and wasn't discussed. Fatigue, pain wasn't even discussed. And now we know that should be covered. But the truth is sometimes it doesn't happen.
It's interesting because, we were reading through some of the materials and in his essay on the shaking palsy, James Parkinson, who Parkinson is named after, so 200 years ago, 1817, he identified this as a key symptom. We've been aware of it. but I don't think it really came into vogue to start to really try to address it until the 90s. I mean, it was one of these things like a lot of non-motor symptoms. It started, we knew about it, and then we're like, oh, but we can solve this tremor thing, or we can solve this movement thing, and therefore the energy went there. So it's interesting that you're talking about a third. We have almost 100% people saying that they have this, and only a third of them are talking to the doctor about it.
So we should try to see, okay, sometimes people discuss symptoms, and because the list is so big, the health professional might, just pass through it, given that the solutions are so limited. So there are lots of reasons can explain behavior. But you know what? If we can't change the doctor, we can try to influence his behavior. And this is a suggestion. If this is your primary symptom and you really want to discuss it with the doctor, a way that I feel that will call his attention is if you go there with a questionnaire that you have filled out, which nowadays everything's available online, and we're happy to share this with you when we send you the recording. It's a simple questionnaire. These are only 6 questions, but it's a little more. But it's a nice, simple questionnaire that you can use. And if you go to the doctor and say, I've been really worried about this problem, and I actually went into this questionnaire, and it gives me
My problem. Sorry.
They even have a way to really give you a score. The score is quite irrelevant for me. It's more about you going through these questions and reflecting how much it's really impacting your life, so that when you are discussing this with the doctor, you also have access to being able to highlight, listen, this is really affecting my socialization and my impact of it.
And in which areas, particularly socialization versus doing something during the day versus getting enough rest? I mean, it's a nice way for you to dial in on where the problem is, because again, we'll find often that the issue may be something related to Parkinson's that looks like it's fatigue, but it's actually influencing your fatigue.
So it's worth discussing and bringing it up, even if you feel maybe I'm just tired. I'll just rest, right? Even if you think that you are managing the problem. So one of the questions that I was intrigued to ask, that we were wondering, it's like, so what happened when the 30% talked with their doctor, and what happened, right? So we can also think about what can we expect. And remember, this is everyone from the area, Washington, Virginia, right? So it's
this is what the survey responses are.
It's specific to your area.
This will also apply to people who may be calling in from outside of Washington and Virginia, but this is what happened when you contacted your doctors. Got it. Yes. Okay,
so here are some examples that people mentioned. So one, the doctor had some lab work done to check for problems, which is ideally, as we said, the diagnosis is very important. So that's the key element, is to really make sure that we are talking about fatigue or we're talking about something else.
Often you could have a thyroid issue, you could have anemia, you could have a vitamin D deficiency, and it all pops up, and that's why blood work is great. Lab work is an excellent start.
And then other mentions that there was an immediate response regarding medication, right? So obviously, if you are talking about a neurologist specialist, a doctor, there will be, what can we change in terms of medication? So we had reducing some medication, which suggests that maybe there might be medication that also provoke fatigue. So it's worth diving deep into that and seeing that. Then we had, the doctor thought I was over-medicated, which validates what I just said. And then medication time change. So it's like sometimes the Parkinson is stable, but this is creeping in very slowly. And then, okay, let's try increasing a little bit the medication and see how you react to it.
And sometimes these medications are not just the Parkinson's meds. It could be something you're taking for blood pressure. Those are common causes. Beta blockers are a common cause for making people a little tired, or other things that you could be taking. Or it could be a combination of both, and this is where the doctor's really going to have to dig in and become a scientist about it.
Yeah, and so we did have the sentence, and we kept the sentences according to how you wrote them. And this can probably be interpreted in different ways, but prescription that causes my hallucinations, I'm not sure if what happened was some medication was prescribed and it provoked hallucinations and had to be removed. So that's one interpretation that could be.
And could be interfering with your ability to sleep and causing anxiety and other stuff like that. So
unfortunately, side effects associated to medication can happen, And it's so important that people can have that communication. You have a change in medication, and you are able to contact the doctor immediately after, right, if something is not going so well. Okay, so hopefully everything's okay. I do see there was let me just try to finish here. So trying to reduce, either reducing the medication or increasing the medication, so that we can see if there's a response to in your Parkinson that would reduce ultimately or that would manage the fatigue.
Yeah, there are no hard and fast rules for that, but they're definitely going to try to work through that first.
And now regarding maybe other tips and strategies that the doctors mentioned to the people that are here, and some told me it's fine to take naps if they help. Limited naps to 1 hour per day. I mentioned this to the doctor, and he was also taking a break here and there, which is correct, and encouraged the person to exercise more, which again, I can imagine is quite a shock. It's like, I'm so tired, how do I exercise more? But yes, physical activity comes up often, and then also antidepressants. Probably there the doctor is finding that maybe the underlying cause might be depression, and that's why he would go this way. But the person said neither helped, so something didn't go so well there.
Yeah, I mean, that's part of doing this differential diagnosis and working your way through what may be the issue and disambiguating it from one from the other.
Which really brings us to the second point, which is make the diagnosis important, and the first step that we could expect from a health professional is to identify if there's anything secondary causing it. And look how many things that can cause fatigue.
Yeah, I mean, again, often occurring in Parkinson's, in addition to the 24 out of 25 people who said that they had fatigue, many of them over a year, depression is quite common in Parkinson's, and it can co-occur, but it's important to identify the depression and try to address that, and then look to the fatigue and try to address that, because if you don't address the depression and you're just going after the fatigue, it could be a problem. Very similar would be a sleep disorder. So people were talking about having a lot of daytime sleepiness. Probably that's maybe related to not getting enough sleep at night. It could also be related to a medication that's causing that. Other medical conditions are also important. This is, again, when your doctor is doing the initial intake and talking to you about the medications you're taking, and not just Parkinson's. They may be looking for other, like a coronary kind of a condition or something that affects your cardiac function. That could be an issue, or breathing issues, dyspnea or COPD could have an influence on your ability to be able to get enough blood and enough oxygen, and that could influence it. And so they're trying to rule all those things out so they can really dial in on the Parkinson's symptoms.
Yeah, and then when we think about the complexity of Parkinson, I think this is the cruelty. It's like, as you can see, there's so many symptoms that can ultimately, if there is some sort of aggravation, you have an infection or something, the Parkinson medication is compromised, it's not working so well, and you feel more tired. So, and people will perceive this as more tired when the medication is not working so well, sure. Right? Or as they should. Or if you have changes in your posture or in your gait. And so, as you can see, it's just, if something in Parkinson is more destabilized or gets worse or progresses, it would be, immediate response would be you're feeling more tired because you don't have the energy to be able to activate and do the movements, which the dopamine, you can see, also gives you that. So by this is just, I think the two main ones that we want to highlight is that making sure that what is going through the professional set is this, okay, is this an aggravation of the depression? Did the depression become worse? Did the sleep problems become worse, right? So you can have specific things that will cue you that if the person is have early morning fatigue, then that's probably something that's related to the sleep during the night, as we saw that someone mentioned in the questionnaires. Or if I'm sleeping more during the day, what's happening with that? Remember that fatigue is something that you're feeling tired all the time. Let's say it won't be very specific to a certain time. It can be, but it's not so commonly. So focusing on being able to differentiate the diagnosis and being if we can, because depression is treatable, sleep is treatable. Okay, it might be limited, but it is treatable.
And even if it doesn't improve the fatigue, it can often, and doctors are going to head there first, which is great. it's not wasted time. Addressing depression and improving your sleep function is going to have a lot of other benefits, even if it doesn't directly address the fatigue or solve that. But it can solve it. It's one of these things where you have to try it and work with your doctor.
So before we jump on to the third care strategy for you, I just want to check in the chat because I saw that there was a question there, or there was a comment. And so just to see if it's related to this or not.
Oh, yeah. Someone's saying that the movement disorder specialist focuses more on severe symptoms. Are you falling asleep while eating rather than general fatigue?
Yes.
And what I would say is, when it gets to a point where it's severe, when it's interfering with your daily living, when it's making it difficult for you to do the things you need to do in life and socialize, now it becomes a severe symptom. Obviously, falling asleep while you're eating is pretty severe. Having a fall risk is pretty severe. Those are real. But again, once it gets to a point where it's interfering with your ability to live, then it might crop up on there a little bit higher. So that's a great insight, though.
But I think this is one of the situations where I would probably use the questionnaire, so that it will highlight that you're really concerned about this, right? And you guys know your doctors better, right? And you know what will influence more. And again, we are generous to think that the list is so big, and he's going to try to discuss what he can change. And probably even if you complain about fatigue, he's going to immediately think sleep or depression. And so he's going to try to get these questions out. Are you sleeping while you're eating, which is the most severe on the scale of sleep, right? So it seems normal, but if you really want to come back to it, I think I wouldn't say intimidating. I'm looking for the right word. It's like when I take something really seriously, like I'm taking a question, I was like, I want you to understand this is affecting several parts, and I really want to discuss this. And that's why you're here today. So you have these talks so that you can be aware that it's okay to discuss this topic with them.
I think you start pulling on questions like, is this questionnaire worthy? It's like, yes. Now you've elevated, you've escalated to another level. Yeah.
It's recommended for people to use by the Parkinson community.
It helps you understand it, and also helps you understand where it is. So it's not just, I'm
tired.
And
it's just an example, because there's more, right?
Sure.
But we just want one to call his attention, right, or their attention. Okay, so when we think about in any problem with Parkinson, the way people deal with it, and if we are able to identify things that make it worse, it's probably a way for us to think, if I do the opposite, it might be a solution. So it's a nice way to look at problems is, can I identify things that make it worse? Can I identify things that make it better? And to keep track of that, because sometimes we perceive that something is good, but once you get a list like this was an example of what people mentioned. So I know that my fatigue gets worse, and 19 people said this, a poor night's sleep, okay? I would say that when I'm in the clinic and somebody comes in and they don't feel so good, my first question is immediately, did you sleep well? Because it's a common problem in Parkinson, and so this did not surprise me. A poor night's sleep will influence your energy levels throughout the day. Again, coming back to the concept of fatigue, more complex, this is related to sleep, right? And then we had 11 people saying, okay, physical exertion. So when I do sports and exercise, and this is one that touches me deeply, because people are being stimulated to do a lot of vigorous exercise. And one way to protect yourself is to understand that when you do exercise, it's supposed to help you get more energy. And if it's draining you, that means the dosage is not right. If you go to bed the rest of the day after doing an exercise class, something is wrong. Exercise cannot steal a whole afternoon of your life. So something has to change. That would be my major tip. And then we had other things like a busy day. Can we do anything about a busy day? I would love to hear your voices here.
Yeah, sure.
Because it's, you see these factors and you think, how do we get so involved in putting so much on our to-do list that a busy day is what's really contributing to the fatigue? And then you can say, but we did nothing. We just got up in the morning, we got dressed, and we were exhausted, and we just went out for coffee and came back and did lunch. And so some people, it's like, it's the busy day is giving enough time to do those activities that we may take longer. Getting dressed takes much longer, right? Getting ready to go out takes much longer. And I think obviously you're aware of it, you deal with it every single day, but it's just when we see it in writing, hopefully it makes us more alerted for this. So you have other things here. Let's look at this. Emotions that are either negative or positive can make people more fatigued. So positive, it seems like almost cruel, right? It's like, yeah, I get some happy news. I just won the lottery. Oh, that's not you just had a new grandkid or something like that. And so the excitement, and then you get fatigued with probably it's the cognitive impact of dealing with the emotions as well.
It must be a lot of energy too, yeah. And then we see this a lot, and we're getting into the season where being overheated certainly has an influence, especially in climates that are more humid and tropical. And also sometimes
Yeah, I was gonna. You were mentioning right because it's one of the strategies that. No.
But it's one of these things where it could be triggering fatigue, but it could also be an indication of orthostatic hypotension, which also may come on more as you become the temperature becomes dysregulated. So.
And that on its own will affect your capacity to think as well, and to be engaged. So here we are. It's like we make a list of things that potentially could trigger. And if I'm aware of this, maybe when I go out, I will be more attentive to the fact that I would study the environment that I am. Is it possible to open up a window? Yeah. Is it possible for me to stand up and go outside a bit? So just keeping that in mind. So the lists help us find solutions. This is another one, is when we are waiting in the stores for something. So prolonged standing position. Sometimes but you didn't do anything. You were just standing there. Yeah, just standing there has a lot. It has a lot of muscles that are working. It's fighting against balance. It's trying to be attentive while I keep my upright position. And so that can be a lot. Besides the fact that it can also be related to, again, your blood pressure going down, and then that being the cause of fatigue.
You've mentioned this so many times, but it's just we're designed to move. So being in a static position is actually not the way our bodies are really designed. So you can do it, but boy, if you're stuck and in hot weather, you're stuck standing in a big line like this, that'd be a big mess.
Well, we like to brainstorm on solutions. It's like now you have all those portable chairs that you can just carry like a suitcase, right, or a backpack. And then you just take out your chair and be super cool and sit down, and everyone will be jealous. Yeah. So it's again,
cool, I'm not sure,
humans
but jealous,
were made to move, so we're moving and changing positions. So not too much sitting, not too much standing, not too much walking. Right? It's just it has to be the right dosage.
Goldilocks. There was only one person that mentioned this in this survey, but this is another common thing that happens after large meals, particularly meals that have high carbohydrates, a lot of sugar and processed sugars, that people will have what we call a postprandial fatigue. Prandial meaning it's while you're digesting, the blood flow goes down into your stomach, and it takes blood from your brain, and it makes you tired and fatigued. So the key for this would be like a lot of other things you would deal with hypotension, and it's just to have smaller, more frequent meals, and to avoid meals that are really carbo-loaded. So high fructose corn syrup and processed sugars are really going to slow you down. Some people might have a reaction to products that are like heavy meats. Some people might have products that are also gluten-based, but really it's the complex carbohydrates that are usually the culprit.
Mm-hmm. And I would probably raise awareness to the amount of time that people take to eat, even chewing, right? But like, for example, specifically in my country, we take an hour, sometimes 1 hour and a half to eat and socialize. So that's very exhausting. By the time people get out of the table, they are so exhausted. I recall I do lots of activities with people with Parkinson. One of them is have meals together. And I think the longest that I took was 2 hours and a half of someone challenged to eat. So I think just being aware of, can I maybe break up a little bit that activity, maybe stand up once in a while, and then come back to the food. I know usually Americans eat food that's more cold, salads and stuff. You will. So maybe it's not a problem for us. It's the question of the food's going to get cold.
One thing I'll say too is that if you are having extended meal times, that may be related to how difficult it is for you to eat. That's a slightly different issue. It's not really within the framework here, but that could be a reason to modify the way you're eating and work with a speech language pathologist to maybe address any kind of underlying swallowing issues, or if it's more fine motor, it's really occupational therapy will really help you with that as well. But actually, either one of us can really do that kind of work.
So these are just examples. If you identify things that make it worse, you can think about solutions about how can I reduce it. And if you feel that maybe you're not confident of thinking about solutions, this is where taking a list like this, things that make it worse, will help the professionals that you enter in contact think about solutions, because they have contact with lots of different people with Parkinson. And oh yes, I once had this person that tried this and it worked, right?
Yeah.
So even when we don't have evidence, we do have a lot of experience of people sharing how they deal with the problem. When we think about, okay, so concrete management strategies. So what in most of the things that we were reading about, this was always, you had like a book and you had one paragraph of the solutions, which was quite disappointing. But the truth is, as you saw in the comment, fatigue is like everywhere. And so it's like not recognized as it should, as a major symptom, because I think this is one of the most common barriers that people, it's just, I just feel so tired all the time, and that's my Parkinson.
Yeah, and this is going to sound like a broken record. I feel like I said it every time we get here. This is also why working with a doctor that has a lot of experience in this space, because again, it becomes a situation, and people say this all the time to us. It's like you go talk to a doctor that doesn't have as much background, maybe in primary care, and it's like everything's related to your Parkinson's. Oh, well, that's because you're Parkinson's. That's because you're Parkinson's. And if you come in and say I'm fatigued, and it's like, whoa, it's your Parkinson's, and you're sleepy, and you have these other things. And a movement disorder specialist is going to really help break it down to understand how to deal with it, and then they also will have a larger body of experience about how to manage it with the pharmaceutical and the energy management and the exercise. And some of this comes from other fields too. Some of this comes from like MS and dealing with other issues.
Yeah, or cancer.
Cancer.
Well.
I wanted to add just a bit to that. I had a situation that happened just the other day where a client who had been complaining of a lot of fatigue, and we'd asked him to go and talk to his doctor, make sure that they knew that this was a real issue for him. What he found out was they did some testing, put a Holter monitor on him, and found out that he had a very severe cardiac condition and required an emergency pacemaker. So this is a person who really could have had a heart attack at any time. And because he reported it, he got the treatment that he needed. So it can be the flip side too. It's easy to blame Parkinson's for everything. And sometimes we do that in jest and say, oh, well, the Parkinson's makes everything worse. And that is true, but it's not the only thing that's true. So
that's a great insight. And that's one of these situations where that's a very treatable with a very reliable, like pacemaker placement's a very reliable way to treat that. That could be life-changing for somebody. Immediately the fatigue gets mitigated very directly, and that's fantastic. So great insights. Yeah, good. Thanks, Nancy.
So this is how people organize the options that we have at this moment. Okay, so we can have pharmacological adjustments. So as you saw, either increasing or decreasing, finding out what the problem is and treating it pharmacologically. And then there is a school called energy management strategies, which is basically looking how you're doing your activities of daily living and how can we save energy here or there. So this is more about planning tips and strategies. And then, of course, could not fail, and then the exercise. And the exercise deserves a little reflection on that. But before that, let's think about the common strategies that people usually mentioned. We're going to mix here things that commonly we hear about and things that you also mentioned in the questionnaires. And the way we like to think about this is whatever you do, or if you identify a situation where you're dealing with fatigue, is to try to look at it as, is there something that I can do about the person, behavior? Is there something that I can do about the activity itself that I can change? Maybe the person's getting awfully tired because he's getting out of a chair that's very difficult to get out. So maybe I can either teach strategies or I can just change the chair, and here it's the environment, right? Can I just modify things so that I can reduce the amount of effort that people are doing in their activities? So this is one way to look at the problem.
And that fits also movement related, but also communication, because it often takes a lot of effort. This is another, it's the ancillary benefit of the exercise. Hopefully you're improving function and capacity, but also you're just making it less effort because you're building your capacity to communicate or transfer or ambulate or whatever it is.
So we'll go through just a couple. Now, who can guess the number one strategy that people use?
That'd be my favorite one. I'm on board for it.
Although I would expect, just sitting back and relaxing, but actually naps came out as the most frequent one. And I would imagine that's also what health professionals would say, why don't you take a nap, and that will help restore the energy. And then we had people that mentioned afternoon naps, long naps, only to allow enough rest, and then frequent naps, especially after taking the medication and eating. Right? You see those moments specifically when the person goes down.
I think the long nap is the one that I might push back a little bit against. I think longer than 20 minutes really.
Yes, from the sleep specialists that I often hear from, the recommendation is 20 minutes. Which some people, if you have difficulty falling asleep, might seem short. But typically in Parkinson, people don't have that much difficulty falling asleep during the day, right? It's because it's sudden, it's sleep attacks. And the recommendation was that the person should lie down in their bed in darkness. I heard this recently, which was interesting because people might run away from that strategy because it's difficult to get in bed and then get out, but might take 5 minutes or more. So it's just worth understanding. The goal is for you to feel rested in a good position. So falling asleep maybe on the couch where your head is falling forward is probably not as restful, and when you wake up you might have more body aches and discomfort. That is worth considering.
Your sleep specialist too, that they probably mentioned not getting the naps too late in the day. If you take too long a nap or you take it too late in the afternoon, there's a real risk of...
Yeah, what I heard was until 3 o'clock, and this is based on the Portuguese that go to bed around 11 or so, or midnight. So I would imagine that the time schedules for the US would probably be different.
Yeah, what time do you eat dinner?
Yeah, that wouldn't affect your night.
Yeah.
It's nice if you want a place to relax too. Lift recliners can be super fun. They're nice at night. They're also nice during the day. A lift recliner is one that has a mechanical lift to it, so you can lie back and actually get pretty flat and raise your feet up if you want. But it also will stand you up literally. And they're really nice if you take a nap and then you think, oh, the longer I'm lying down, the harder it is to get back up. Well, you just push your button and it gets you up. And it does really help. Can help at night too. If you say have somebody who watches TV at night and then they get tired and they can't rouse themselves enough to get out of the couch and then go upstairs to bed, it can really help.
That's great. It's electric lift recliner, is that right?
Yeah. And they can make some pretty posh ones. I have one that even has a heater in it. So if you have a sore back or something. The other thing that I had heard some of my clients talk about was this idea of taking a nap, but right before the nap, you maybe drink a coffee or something with some caffeine in it. And so you take your short nap, maybe about 20 minutes, and by that time the caffeine kicks in and you're ready to pop up and go again a little bit more spryly.
I've heard that too, because coffee is what's called an adenosine type 2 receptor antagonist, or an A2A receptor antagonist. And what happens, sleep helps that release. So if you drink the coffee right before then, you actually get better effect of the coffee. So that's a great insight, Nancy. Yeah, excellent.
Yeah, so I was just going to add that sometimes naps don't, people might wake up more grumpy. So do consider that.
Yeah, wrong side of the cycle, too long.
Yes. So if it's too long, maybe it will also be negative because of that.
Along with the coffee too, there are some medications that the research on them is kind of inconclusive. Again, Dr. Kluger's excellent textbook chapter talks about maybe the design of those weren't strong enough to get the power that they needed to actually identify it, because he has used it clinically. That's something else your doctor might like methylphenidate or something like that might consider in the mix there. And coffee would be part of that as well.
I think
Yeah, you got it in there. Yeah. Okay.
This was another one that was mentioned, which is reading, sitting down quietly,
Yeah, rest.
Resting for a while. I don't know how much the reading but if the person really likes to read, it's find your strategy that makes you forget about the fatigue, right? To really focus on, really be attentive to the task that you're doing. It's about deviating.
Not doom scrolling on Facebook and watching political stuff.
So people might use reading as a strategy to fall asleep at night.
Yeah.
But if you are really passionate about reading and you have a book that you're really interested in, I'm sure that helps with the fatigue for sure. It helps with the alertness.
Yeah, no, very good. Yeah, ways to tune down. Nighttime too, just getting rid of some of the stimuli.
Yeah. Then this one is it's good for us to identify even things that seem obvious, because sometimes when you're dealing with the problem, you might feel so overwhelmed that you might not consider this. So it's really looking about the activities that really bring on a lot of fatigue, and is there something that I can do about the activity, about the intensity that I'm doing, and the duration of these activities, how much time. Imagine I go out for a social event, right? And it's like maybe I can have either mini breaks where, if I was a person with Parkinson, I run to the toilet and just rest for a while. If you are not able to run somewhere else, and to just get away from all the conversations, because that induces fatigue as well, or breaking it down. And as you saw, one of the people that mentioned, we actually leave earlier so that it doesn't induce so much discomfort.
I think it's totally appropriate. Plan
But
your
maybe
time.
thinking about breaks in between will help you stay longer, if that's one of the goals. Imagine they're going to sing happy birthday only at the end of the activity, right? And you have to hold on.
I think if someone has one of those recliners Nancy was mentioning, you can just audition it.
It's being open to changing habits, right? So that you're not so that you can help others help you, because I'm sure everyone around wants to help somehow. So if you create these safety zones, that would be interesting. So what people mentioned was, I spread out tasks during the day, right? As you said, this is it's not a question of us stating the obvious, it's for us reflecting on what people are doing. Not as fatigued during the on time with medications. So some people will perceive that when their medication are working well, they don't feel so tired, which I will connect it with posture as well, and gait, and the less effort that we have. And then I plan my time carefully. We can only imagine. I ask for help. That's also, here I am highlighting that people are generous in helping others, or at least normal people are. And that means people will want to find solutions to be able to help you. If you just say, I just need 5 minutes right now, I'll be right back. That could be also a strategy to use.
Just being willing to speak up a little bit helps a lot of that.
Mm-hmm. Or if you plan family activities, and maybe if you feel more tired in the evenings, you will try to avoid planning activities for that time. It's a lot of good sense, right? Just thinking about that. We did want to highlight here specifically Parkinson, that we know fluctuates, and that we know that the medication really is the drive for these intervals of more energy or less energy. So the on-off phenomena is something that can be perceived as the medication stops wearing off or is not working so well, I get more tired, I get more difficulty to think. So I think it's a clear symptom of the medication not working so well, what we call wearing off. And so it's important for us to see that. Okay, so how, at what times of the day do you feel that the person is most fatigued? Identify that moment so that you can plan your activities according to that. being that fatigue can be the whole day, as you can see, 32% of the people said, yeah, but the person's tired the whole day. How do I manage this?
I think yeah. I mean, that again, you want to start dialing in on other causes as well, too.
It's either the true definition of fatigue would be the whole day, and then feeling at the end of the day, there you're already accumulating the activities that you've done. So there you've got more physical fatigue coming in and mental fatigue as well, contributing to the
not
problem.
providing the benefits. Yeah, I'm sorry, didn't get in there. Yeah, sorry.
Yes. So just highlighting here that be aware about what this means, what on-off means, what it means when you are coming close to taking your medication. The half an hour before is probably not going to be so comfortable. The person starts getting more tired. What we consider the off periods is described subjectively by people in very different ways. So it can be motor symptoms that you feel more rigid, you feel slower, or it can be non-motor where I'm having more difficulty to concentrate, or I'm feeling more fatigued. Okay. This was an interesting comment that people added in that I thought was interesting, which is reducing expectations. So basically it's managing how many activities that I can handle and really focusing on enjoying the moments that you are able to do something.
I think along with that is just understanding how much more energy every little task takes and being considerate of yourself, not being so harsh in your judgments of, well, I used to be able to do that. Why can't I do that? Everybody else can do it. Well, everybody else isn't dealing, with trying to cognitively, consciously organize so many things at once. So much more of their activity, whether it's talking or standing or walking or whatever it is they're doing, it's happening automatically. So it's not taking the physical toll on them.
Yeah, I think saying that what I used to be able to do is like the worst way for anyone to live, Parkinson's or not. We mentioned this before. Yeah.
Yes, we mentioned so some other strategies would be coffee. We know that coffee is used as a non-pharmacological strategy after eating. It's in the recommendations of the Movement Disorder Society, so we can mention it. But obviously you have to see the effect it has on you, because it's something that either works really well or it works really bad. So.
And again, this is also kind of getting to a little bit of the sleepiness and the sitting in the sunshine. I mean, that's working on daylight spectrum, 5400 K, 5400 Kelvin daylight spectrum light. You can also do that with a light, but again, that's getting more towards sleepiness. I want to just real quickly say that the supplements, there's not any peer-reviewed evidence to support it. Although Dr. Kluger, again, very cogently says sometimes it does help people, and maybe it's even placebo effect. It doesn't matter if it's helping. If as long as it's not hurting, there's nothing wrong with it. It's just nothing out there that says this is definitely going to help you. Ginkgo biloba is going to do it. It's like, no.
And I would just reinforce that do share this with your doctor so that he's aware of what you're taking as vitamins, because some of them are already being studied and might interfere or not with the medication. So it's really worth discussing this with them.
Standard supplement disclaimer too is some of those supplements might have effects that could impact other drugs. The MAOB inhibitor will not work with certain supplements. So yeah.
Okay, so going on to another one, which would be mental fatigue.
Yeah, and again, this can be a lot of times it just focus on all the cognitive work, but also I would say that there are simple things you can do with respect to hearing loss and vision loss, that if you can address that oftentimes you spend less energy having to pay attention and take in the information. So obviously the mental fatigue is something that people complain of a lot. A simple fix would be to make sure that you're hearing well, and if you don't, add a hearing aid, and if you're seeing well.
And then being aware about how alternating your attention with things becomes more challenging in Parkinson.
Yeah.
So I'd have often when I go walking with my sister, she talks so much, I get so tired, right? And then there you have the walking as well, you have someone talking as well, and she has severe balance issues. So all this will interfere and make her feel really challenged.
And this environment too would be particularly bad because there's a lot of noise and chaos and noise. Having to understand in the background noise is also a lot of effort.
So it doesn't mean that the person should stop doing those activities. It means that probably you have to specifically address them in exercise and intervention options. But also being aware that maybe you can reduce the amount of times that you are submitted to it, or the way you are placing yourself in these situations. So reducing the amount of time that you are placed in situations where your attention has to be divided all the time. Another one to highlight, and I'm just going to be here because of time, just thinking that pain can also induce a lot of fatigue, and which is so just highlighting and being aware that these things can contribute to fatigue, it can contribute to depression and to sleep as well. So it's almost like the bubble never ends, because it's there's always something else that can be.
But addressing that pain can be very valuable.
Yeah. So coming to activity, what can we say about someone that feels completely exhausted and now they have to exercise? And that I would say that really find something that the person can do and use that as your way to increase it progressively, right? So for example, the person is able to do a 5-minute walk. Why not do that more often? So I'll do 5 minutes, I'll rest, and then I'll do 5 minutes and I'll rest. So gradually the person will become more conditionally, physically capacity. And so that means that then you can think about other options. Now, how about we joining an exercise class? But if you go immediately to an exercise class and the person just hearing everyone screaming and shouting and doing their exercises is already going to induce a lot of fatigue. And so there you're creating already a barrier for adherence.
I think in extreme cases too, where you just can't even imagine yourself moving, period, you can start to rely on some of those basic motivational factors that affect your brain, like movement and oxygen. It might seem very simple, but even being outside, like you mentioned in one of your earlier slides, for the sunshine, but also the fresh air. You get more oxygen outdoors than you do indoors. But if you're indoors stuck on the couch, you can't even imagine getting up and even just standing and sitting or taking a little 5-minute walk break. It might be something where you just start by simply moving your eyes or your head, taking a deep breath, rolling your shoulders, anything, any kind of movement, small as it might be, can just get the ball rolling and get you closer to that. Oh yeah, I do feel like I can do this now. And I don't have to push the button on my remote or my recliner to lift me up. I can actually do that.
Yeah, so it's just like getting I would highlight like the amount of hours that we are sitting down, like just getting up is already an exercise in situations where apathy, which is a different, like depression and extreme fatigue are happening. So just getting up, just get moving, right? Get that oxygen. So this was things that I said I would like to increase my stamina, but exercise is difficult. I sleep better when I do exercise. My PT motion is lotion. So yes, people, I just want to share with you that so one of the highlights here is like relation between exercise. The most common one, people were saying exercising does not change the amount of fatigue I experience. It is indirectly probably helping you to get more physical capacity, I would say, but not as a treatment on itself. And that's why it really has to be progressive, because if you do more vigorous, you will just induce more the fatigue, right? And highlighting again the pressure that we get about doing a lot of vigorous exercise at this moment as the tool to keep Parkinson controlled.
But making sure it's really tailored towards your real capacity, not as much as possible, no matter what.
Yeah. So when we see specifically, studies that are looking into what type of exercise would be relevant for fatigue, we got these solutions. Was physically engaging video games. Sometimes if the person is really having fun in something, they might not be so attentive to the fatigue. So that kind of like distracts him from the fatigue. I would say my best strategy that I feel when people are really dealing with struggling to doing exercise is hydrotherapy, hydrogymnastics in a calm environment, because inside water, people tend to move more and they feel the benefit of the moving without feeling so tired. And once you get out of the pool, you also feel more alert as well. So obviously there's lots of barriers for people to do, exercises inside water. There can be endless things. But the truth is, it is the one that seems to work well from my experience.
And fun. Fun would be my key ingredient. It just, it has to be fun or you're not gonna want to do it again.
Yeah. There's only so many eating your Wheaties you can really do.
And if the if the exercise is really causing you, you go to it, you in an exercise class and it's really causing, it should, you can go to an exercise class and feel tired after. It should not take you to bed the whole day. And eventually, as you do it more, it should reduce, right? So the fatigue should be reducing. If it's not, then again, the dosage is probably wrong. And in these cases, when you are unable to get the perception of benefit of exercise, specialized therapy obviously can help you target better problems that might be contributing.
Good.
And this is just a quick example, which is if you have changes in your gait, if you have changes in your posture that you can see here, you can easily see that this will make this person be very tired every time he walks, even 10 meters, right? So by improving gait and balance, then this gentleman will have less fatigue.
Same with communication too.
Yeah.
If you can improve that, it will help.
And this was just an example of someone that actually we were trying to manage falls, and the gentleman made so much, he perceived that he fell because he took so long to get out of the car that probably he's just making so much effort without even breathing. So like this is what we call about muscle fatigue and immediate fatigue. And so right after he just fell.
Quer sair daí e tal precisar esse apoio, força.
And so what we did was by having, just looking at how he's doing, and we just taught him some strategies about how he would get out of the car. And as you can see from the timer, it took less than half of the time. So simple things like this that the health professionals can help you identify. And with this, also by having talks like this about the topic, hopefully there will be more and more about this and we'll have more solutions, but just keeping updated on new things and not losing hope that everyone's looking at it in a different way at this moment.